Perform a scene survey and make sure everyone is safe. Ask what happened to learn the history of the incident. Identify yourself as a first aider and offer assistance. Make the casualty comfortable and perform a primary survey. Airway and breathing are easy to check by asking where it hurts, but check for shock by checking the skin condition and temperature and do a rapid body survey to ensure there are no other serious injuries. The casualty will support and immobilize their injury. Expose the injury and examine the area. The casualty will try to support the weight of the hand to lessen the pain. A fracture may show bruising, swelling, and an abnormal shape to the bone. Compare the area to the uninjured arm. Is there tenderness at this site and pain when the hand is moved? If a fracture or dislocation is suspected, the casualty requires medical attention. If an ambulance is coming, provide ongoing care. The casualty will support and immobilize their injury. If you must move the casualty, then the injury must be immobilized to prevent further injury. First aiders should consider transporting a casualty only if the injury is not life-threatening, when the first aider is a family member, transportation is not a risk for the casualty and the first aider, and medical help is delayed or cannot be reached. Perform a modified secondary survey. Take a sample history and record a baseline set of vitals. When a wrist injury is the casualty's only complaint, and when other injuries are not suspected, examine the arm from top to bottom to determine the injury site. Check the distal circulation by comparing the temperature and color of the fingers on the injured side with the uninjured side. Immobilize the wrist in the position found by applying a padded splint bandage in place and adding extra padding under the wrist and hand in order to maintain the joint in the position found. Be sure to remove the casualty's jewelry at the wrist and fingers before applying the splint in case of swelling. Tie off bandages at the stable part first, above the fracture site, avoiding the fracture site, and tie bandages tightly but not so tight as to cut off circulation. Support the splinted arm with an arm sling. Place a triangular bandage between the forearm and the chest with the point extending past the elbow. Bring the top end over the casualty's shoulder on the uninjured side and around the neck. Bring the lower end of the bandage over the forearm and tie off in the hollow above the collarbone on the injured side. Place padding underneath the knot. Make sure the casualty's hand is inside the sling, but that the fingernails are exposed for circulation checks. Twist the point at the elbow into a pigtail and tuck it inside the sling. Check the distal circulation again by comparing the temperature and color of the fingers on the injured side with the uninjured side. If the bandages are too tight, or swelling has made them too tight, there will be a slow return of color when the nail bed is depressed and released, and the fingers may be bluish and cold to the touch. If the circulation was adequate before splinting and becomes poor, the bandages must be loosened. If circulation is not impaired, cold should be applied continuously for 15 minutes on and 15 minutes off to help reduce swelling and pain, providing the casualty can tolerate the added weight. Take a second set of vitals and check again for shock. If it is still safe to do so, the casualty may now be taken to medical aid.